Welcome to this online learning about kinesiology taping and pain. Now, pain is a huge topic. As part of this presentation, we are covering the basics about why people may feel pain and how to work with your clients that are experiencing pain within manual therapies. Now, it is just the tip of the iceberg, and there is so much really interesting research and references out there. We've covered some of them at the very bottom of this presentation within the resources, but I suggest that you start furthering your learning in this area, as if you work with clients day to day, it's really important to know why people feel pain and how to really help them during that process. What's really interesting is the combination of how kinesiology taping may help people that are feeling pain, which is what we're going to talk about for the rest of the presentation. What we will cover in this learning, we're going to begin with discussing why some people feel pain and others don't, which then forms into how we feel pain. And we're going to discuss briefly about how people feel pain. We're also going to discuss why understanding the basics of why people feel pain is important when you're working with your clients within a hands-on, clinical, or a movement perspective. And the second part of this learning is all about kinesiology taping and how kinesiology taping may help people with pain. And we'll also discuss some of the research that is out there based on this. And then finally, we're going to discuss how kinesiology taping can form a part of a whole treatment to help your clients and patients within pain. So, what is pain? Pain occurs when the brain perceives a damage or threat of danger and needs to take a response and take action. So as an example that pain isn't always an indicator of tissue damage, this article came out a few years ago, and it was where a man in the US, I think, and this quote comes from the Mosley and Butler Explain Pain book. And this is really important when we're working with our clients to understand this. So we believe that even Nocioception. We discussed nocioceptors briefly in the fascia as a sensory organ online learning, and these are sensory neurons that respond to certain. So let's just recap on how pain is created. Now, Laura Mosley will definitely explain it in a more interesting way that I will explain this, but it just gives you an idea of. So once the brain has the information from the nocioceptors, then it needs to make a decision on whether to provide a pain response. So it takes all of the information and it constructs a story based on. And then here are some of the factors involved in whether things are painful or not. So the first one is tissue injury. And if you have an injured tissue, you may feel pain, and this graph just looks at the inflammation and pain as well. So as you can see here, that you have the time of the injury, so that's when things happen, and then pain. And then based on your client's healing times and road to recovery, when they are experiencing something like chronic pain or they have had an injury for a little while and they're frustrated, sensitization of the tissues. Sensitization is where the nocioceptors are heightened and they activate the alarm signals sooner than necessary. And when clients avoid, and this image was taken from the Butler and Mosley book, Explain Pain, and it's a great way to help clients understand the relationship of pain, the nervous system, and how we can add greater. So now we've discussed on why people may feel pain. Let's link that with our knowledge of kinesiology taping and how that might help with those clients that are experiencing that chronic pain. So what we think happens when kinesiology tape is applied to the skin is that it creates a novel, so a new, but also non-painful stimuli to the skin. So it's new, it's something different that the nerves and the sensory nerve endings have to be aware of. And then what we think may happen from there is that this new stimuli distracts and then desensitize the nocioceptors, so the danger detectors, which then can potentially reduce the feeling of pain. I think also alongside that is that when a patient has kinesiology tape applied to them, they're aware that something has happened to that area of the body, which also may help them feel more calm, that something is happening to help improve that injury or that pain that they're experiencing. And it's a reminder that it's on its way to getting better, which also may help reduce pain. So it's not just the pain is reduced by the application of tape, but also how the client perceives the tape has been applied and why it has been applied. So that distraction or that desensitization is created by sensory or pain gating. It's often called both. And what it is where there's a new sensory stimuli that distracts from another stimuli. As an example, if you've banged your elbow, you give your elbow a bit of a rub, and that distracts and then reduces the pain experience of the area that you've potentially hurt. And that's what we think happens with kinesiology tape. So that the tape is applied to the area, which creates a new stimuli, which then may distract from any other stimuli. So where the nocioceptors are detecting danger, and then it calms the area down because the new stimuli, which is more calming to that particular area. Linking in with the sensory gating or pain gating, we can go back to those Ruffini receptors we discussed in the science module. And that kinesiology tape helps stimulate the Ruffini receptors, so creating that stretch on the skin. And what might happen with the use of kinesiology tape around joints is that it creates a movement illusion. So it tricks the brain into thinking that there's been a movement applied to that particular area or that particular joint, even though no movement has taken place. And then when the brain has received this information, it thinks that the body is moved, but also moved without pain, which then also may help the patient encourage to move themselves within that pain-free range because pain has been reduced in that area. And there's a study there that discusses the skin stretch relation to movement illusion, and that may be applied to kinesiology. So in terms of studies and kinesiology taping and pain, and there have been lots of studies about this, and many of the studies have suggested that kinesiology taping may help patients reduce pain in the short term, but there isn't much research that's there about long-term use. So short-term use is often helpful to reduce pain, but there isn't really any research there for any long-term use, which is also good because if we're using kinesio tape for a long period of time, what is happening to those tissues? Is the client moving, or are they using kinesiology tape as a crutch, as a band-aid, rather than actually dealing with the issue at hand? So when it comes to using kinesiology tape, it's not about using it on its own. It's about creating that whole treatment, as we've discussed in many of the other online learnings. And your whole treatment is what helps the client or patient reduce their experience of pain, not just one technique or one modality. And that includes everything. So the environment that you work in, what you wear, the words that you use with your client as well. All of those things are really important. And also how you talk about kinesiology tape, that can make a big difference, we think, based on the efficacy of that treatment. From the research, we know that kinesiology tape may help with some short-term relief, which is great if then we can create that desensitization of the tissues, which then stops that client from guarding and protecting and avoiding those movements. And we know that we need them to load the tissues to help the healing process. So if kinesiology taping can give them that short-term relief, so they feel better, and then they'll be more compliant with those exercises to get the desired result that we want. Now, there is lots of research out there that says kinesiology taping may not reduce pain, and it depends on the patient and everything else involved in it as well. And here are some references and resources based on this presentation. So the first one, the BBC link, that is the link to the news article about the gentleman with the nail through his skull. And the others are really good resources on pain science. So Todd Hargrove, A Guide to Better Movement, is an excellent book. I would suggest you get that. Mosley and Butler, the Explain Pain book. I use that quite a lot with my patients, and it's a very good book. And the NOI group are really good online. They've got lots of online presence about pain science, so check them out. And then also Greg Lehman, a chiropractor, has also got some really good resources on his website as well, so check those out too.